Hello, my name is Kenneth Burson. I'm a dentist here at the Denver Dentists. I've been practicing for 8 years in this practice and 15 years since graduating. I would say that Invisalign has changed the way that patients in Denver approach straightening their teeth because clear aligner therapy is only gotten better since its onset in the 90s. Back then, it was maybe less than 10% of cases really could truly be effectively treated with clear aligner therapy. And now it's nearly 90% are able to be treated, and 75% of those can be treated by a general dentist. Even relapse crowding to simple minor bite issues can be done by a general dentist with clear aligners like Invisalign or SureSmile. And when the patient is in control, it gives you the ability, unlike braces, to take the trays out if you're in a social setting that you don't want them in, and then get them back in. They do need to be worn for about 22 hours over the course of your treatment every day to effectively get teeth to move. But to be in control, I think, has been the game changer. Invisalign is a company that founded clear aligner therapy. At the Denver Dentist, there's a multitude of companies. One of the major ones I use is SureSmile. And SureSmile, just like Invisalign, it allows to put the patient in control by being able to take in and out the clear aligner trays when in a time that they need to. So if they're, having a speaking engagement or in a social setting where they feel that, they'd be better served to have them out. Invisalign and SureSmile and clear aligners give the patient that ability. Whereas in traditional braces, there's no taking those out unless you see the dentist or orthodontist. So big game changer. And not to mention that what clear aligner therapy can do now versus what it could do 30 years ago is entirely different. I think too often certain patients heard at one point previously 10, 15 years ago, they wouldn't be a candidate. That may have changed. Um, there is so much more that clear aligner therapy can do in compared to what braces do now versus what they were able to do in the past. And I'd say if you have any questions or desires to see if you're a candidate, to give us a call. So Invisalign and clear aligner therapy has exploded in its capabilities. There is still a time and place for traditional braces, but that used to be a mass majority of patients had to have braces. Roughly 90% of the cases could only be treated with braces. That's flipped. I'd say that 10% or less of patients need traditional braces now, and if they desire, could get the same results with clear aligners. So it's not a one shoe fits all. There are still cases, the more complex cases, that do require braces, but those are becoming further and few between. I would say that patient convenience seems to be the number one. With traditional braces, you're having to change wires and rubber bands very frequently. With clear aligners, you're able to get a patient into 10 or 20 trays at a time sometimes, and minimizes their need to come in so regularly like they had to with braces. And then being in control. I think that's the other big player here, is patients having the opportunity to take those Invisalign or clear aligner trays out when they need to really empowers the patient to be in the driver's seat for their success. Those very complex cases or cases that have to go through surgery in addition with doing braces, there are certain movements that yes, still what we can do with braces exceeds what Invisalign can do, but it's come a long way. On its inception, it did about 10% of the cases, and now we're seeing it achieve almost 90% plus of all the cases that are out there are able to be done in clear aligner therapy. So it has its space, but its space has grown and has offered a lot of satisfaction to patients that may have been hesitant about the thought as an adult doing braces and coming in and finding out that they actually are a candidate to clear aligner therapy. If someone in Denver is considering clear aligners like Invisalign, but's not sure if it's the right fit for them, they need to come in and talk to us. Oftentimes I think most curiosities can be resolved by good, thoughtful answers. And that's what you're going to get here. We want to be able to understand what your concerns are, what your hesitations, what your limitations are, and really be able to address those on a personal level to give you peace of mind and make sure that it's something that you're wanting and ready to do.